we touch upon the definitions, indications, the equipment that is used, the various methods of measurement, and the accuracy, the factors which depend on gives the accuracy of the reading. Coming to the definitions. So blood pressure is the lateral force exerted by the blood on vessel wall. When the blood is flowing in the blood vessels, it generates a sort of lateral pressure on the vessel wall. This is the blood pressure. It is divided into systolic and diastolic. Systolic is the force on the vascular wall while heart is contracting. During systole, ventricles contract and this blood is pumped into the peripheral circulation, exerting the lateral pressure over the walls of the blood vessels. This is systolic pressure. Then diastolic is the pressure is the force on the vascular wall while the heart is relaxing. That is during diastole. The mean pressure is the average of the two. Then what are the indications where the student or any medical professional should record the blood pressure? During routine clinical examination. That is when you first encounter the patient during the routine clinical examination, it is the vital data besides the pulse, temperature, you have got to record the blood pressure. In chronic diseases, and when the patient comes with the symptoms of hypertension, and children in emergency care or PACU, and high-risk infants, we should also record once in every year after the age of 3 years. Yes. Then, what is the equipment that is used? You have the sphygmomanometer, you have the automated oscillometric device with cuff, and you should use the appropriate size of the cuff. If the cuff is smaller, you record the high value, and the large cuffs records low value. The size of the cuff is when you should encircle the arm at least 2/3 of the arm circumference so as to say it is appropriate size. So what are the methods of measurement? The direct and indirect. Direct is where catheter is directly placed into the artery. It is accurate method of measuring the blood pressure, but it is invasive, which is not practicable in all the occasions. Indirect is commonly used, the sphygmomanometer with cuff, an oscillometric device. There is an ambulatory measurement of blood pressure and Doppler ultrasound. This image shows how the blood pressure is recorded by sphygmomanometer using the cuff. This is an electronic device, automated recording by the oscillometric method. This is how it is recorded. While recording, you are supposed to listen to the cough sounds. These sounds appear in 5 phases. Phase 1. So this is the appearance of clear tapping sound. Initially, you hear clear tapping sound. This corresponds to systolic pressure. This is followed by phase 2. Sound becomes softer and longer. It does not have any significance. Yeah. Phase 3, sound becomes crisper and louder. The softer sound becomes louder in phase 3. In phase 4, sounds become muffled. This is another a method of measuring the diastolic pressure. And finally, phase 5, sound disappears. This usually corresponds to diastolic pressure. Well, in certain occasions, the sounds gets muffled, never disappears. So we take the phase at which sounds muffled as an alternative method to record the diastolic pressure. But usually, when the sounds disappear, that stage we consider as the diastolic pressure. Then you have to follow certain tips to have the accurate measurement. So what are the tips you are supposed to observe? Delay if the patient has taken coffee. You ask the patient whether he has taken the coffee within 30 minutes of time. Or he has done exercise, he is coming from gym. The duration following the exercise, it should not be within 30 minutes. It should be after 30 minutes. Say after taking coffee or after doing the exercise, you record the blood pressure with a gap of 30 minutes. Because caffeine induces rise in blood pressure and exercise results in fall. So you get the error of blood pressure if it is you record this. You take the blood pressure within 30 minutes following coffee or following exercise. The arm of the patient should be free of clothing. So you should not take the blood pressure over the sleeved arms. And the patient comes with a full sleeved shirt and you record the blood pressure over that, it causes an error in the reading. Do not take on the limbs on infusion. Okay? The patient is on infusion, so you should not use that particular arm for recording the blood pressure. Palpate the artery, that is, palpate the brachial artery to ensure it has got viable pulse. Next, position the arm such that artery at the heart level. High values lower than the heart and low value if it is higher. So, position the arm of the patient in such a way that artery, that is brachial artery, is at the level of the heart. Okay. If the artery's level is higher than the heart, you record the lower blood pressure. So the errors can happen when you do not mind placing the arm at the heart level. Avoid slow and repetitive inflations. It again results in error. Neither the patient nor you should talk while recording. Yes, this interferes with the accuracy of the hearing to the sounds. Dial should be directly facing to you so that there should not be any parallax error. So these are the points that you have got to observe to have the accuracy in the measurement of the blood pressure. So Remember, my dear students, taking the blood pressure should not be taken as a simple way of recording the data. You should take all the precautions in order to get the accuracy in the reading. So certain important points. First, for the sake of accuracy, average 2 readings to be taken. At least 2 readings. You record now and repeat the recording a day later at the same setting. Then a record in both the arms at least once, at least one time. Record in both the arms because there could be variation from arm to arm. Subsequently, record on the arm with higher value. So you recorded in both the arms now. Right arm shows a little higher reading. Left arm at a 5 mm the lower reading. And subsequent recording should be done on the arm which recorded high value. The automated device, when it records high value, repeat by auscultation method. So as to avoid the error. Systolic pressure is usually more in the lower limbs. This is the dictum. Right? Then next, how do you go ahead with the manual blood pressure measurement? Keep the patient sit down or lay down, well relaxed, 2 to 3 minutes before you measure the blood pressure. Ask the patient relax, whether it's supine or sitting down position, so that if the patient is thrown into anxiety, we record higher reading. So keep the patient relaxed for 2 to 3 minutes before you record the blood pressure. And keep the arm kept supported at the heart level. Then BP cuff to be placed at least 2 to 3 centimeters above the cubital fossa, not directly over the cubital fossa, no. Palpate the radial artery and simultaneously inflate the cuff till the pulse disappears. Right? Then add little more. Go ahead, 20 to 30 mm Hg, raise the pressure in the cuff. Deflate the cuff slowly at a rate of 10 mm Hg, wait for 10 seconds. Deflate 10 mm Hg, wait for 10 seconds. Let the patient relax. Then inflate the cuff to earlier value. Then slowly deflate at a rate of 2 to 3 mm Hg per second at that rate. Slowly deflate. Right? Then you suddenly hear the tapping sound. That is the first phase of the Korotkoff sound. That marks the systolic pressure. A tapping sound. Tick, 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 like that. You hear the sound. That marks the systolic pressure. Then continue deflating slowly until the sounds get muffled and finally disappear. The point of disappearance of the sounds marks the diastolic pressure. Then you may ask a question. If the sounds never get disappeared, only you hear the muffled sounds, in such occasions, you take the point of muffling the sounds as the diastolic pressure. Okay? Yeah. Then when you use the automatic device, the technique with regard to position of the patient is the same, but the interpretation is as follows. Systolic and diastolic values more than 98% for age and sex are abnormal. You plot the values under the percentile chart. If the readings are more than 98th percentile for age and sex, they are abnormal. In such occasions, repeat twice in the same sittings. Repeat at least 2 times. If the values less than 90th percentile, well, it's good, and repeat after 1 year. And if you find the values between 90th to 95th percentile, the case is pre-hypertension, and you are supposed to repeat after 6 months. Take the reading after 6 months in patients with the values between 90 to 95th percentile. And stage 1 hypertension is defined as the values between 95th to 99th percentile plus 5. And in such occasions, repeat the reading after 2 weeks. At this stage, the values are more than 99 percentile plus 5. Go about to evaluate the condition so as to proceed with the treatment. These are the steps you have got to observe while recording the blood pressure using the automated device. Then, certain applications. Yankel Brachial Index. This is taken in conditions wherein there is suspected vascular disease in the lower limbs, like Burgess disease, any vascular disease in the lower limbs. The ankle brachial ratio is ratio of the systolic pressures in the ankle to that in the arm. The systolic pressure recorded in the ankle, that is usually higher than that in the arms. So the ratio is more than 1. So more than 1 ratio is normal, right? But in peripheral vascular disease, the value is less. This is again very important. Blood pressure is recorded in both the dorsal pedis and posterior tibial arteries in ankle, and both brachial arteries with the patient in supine. So take the readings in both the limbs. Ratio highest systolic pressure in the ankle and that in the arms should be calculated. Take the highest systolic readings recorded at ankle and the arms, then calculate the ratio. This should be the practical method of doing things. Then, what is orthostatic change? When you record the patient in recumbent position, then ask the patient to sit down and also record in standing posture at rather 1 minute intervals. Then observe the change. What happens? When the patient changes from the lying down position to sitting or the standing position, there is a fall in blood systolic pressure. If it is more than 10 mmHg and there is associated increase in heart rate, that is more than 20 per minute, it is said to be abnormal. This is called orthostatic change. Okay, this has to be recorded on the patients who are on antihypertensives, other drugs which cause fall in blood pressure. So the patients on the antihypertensives should be examined for orthostatic change during every visit to your clinic. What is pulsus paradoxus? It is a normal phenomenon which is exaggerated. A fall in systolic blood pressure, an increase in the heart rate during deep inspiration is a normal phenomenon. With a fall less than 10 mmHg is normal. If the fall of blood pressure is more than 10 mmHg during deep inspiration, it is abnormal. Seen in pericardial tamponade. Right? So why pericardial tamponade? Pericardial tamponade is the pressure exerted on the ventricular walls causing impedance for the ventricular filling during deep inspiration. Okay, when the venous return and the filling of the ventricles is interfered, it reduces the ejection fraction, thereby resulting in fall in blood pressure. So ejection volume is reduced, thereby causing a drop in systolic blood pressure during deep inspiration. This is diagnostic of pericardial tamponade. Well, this is the brief account on blood pressure, and the student has to learn and remember all these points in order to put them into practice, so as to not to commit any mistake in recording this important vital sign, that is blood pressure. Thank you very much for patient listening. If you like this video, right, subscribe to my channel and press the button like. Thank you very much, my dear students. We'll meet again in the next class. Until that time, bye-bye.